No, but the setup is good. It's all good. Uh, Hello, everyone, and welcome to the special health awareness live session by policybazaar.ae. My name is Joe Mohan, and today we are focusing on a health issue that's surprisingly very common yet very misunderstood. It's thyroid disorders. Did you know that nearly 1 out of 10 people in the UAE is estimated to suffer from some or the other form of thyroid dysfunction, and often unknowingly? Women are especially at risk, and many go years without a proper diagnosis because the symptoms are like fatigue or anxiety or weight fluctuations, or and then all of these symptoms are often attributed to stress or daily pressures. And that's why this conversation today is going to be very important. Whether you're managing an existing thyroid condition or simply want to understand the signs of it, this session is here to raise awareness, to bust some myths, and of course, to help you take charge of your own health. Joining us today is a very special guest, Dr. Ajila Nair, general physician who specializes in thyroid and hormone related health. And let's welcome Dr. Ajila. Thank you for joining us
Thank
today, Doctor.
you. Thank you so much, Joe. It was a lovely introduction.
Thank you. So, Doctor, the thyroid may be a small gland, as we all know, but it definitely has a huge impact on our health. So, from how we sleep to how we digest the food, feel emotions, and even manage our energy, thyroid hormones, I think, control more than that we realize. And especially in a fast-paced life, in a fast-paced country like UAE, where we love to stay, work could get a bit stressful, and lifestyle choices or even inconsistent health checks are often very common, and it's easy to miss these subtle signs in life. So how about we dig deep and make this knowledge accessible today for everybody who's watching this session today? And I think you should maybe start off with what is the thyroid gland, and what is it and where is it?
Before talking about what is thyroid, I would say to know what's happening with your thyroid, you should first understand the fact that prevention is more important than cure.
Hmm.
So, to understand what hormonal imbalance is going in your body, everybody has to go through a regular checkup. So, coming to thyroid, it's a small gland which is situated in front of your neck, a butterfly shaped gland which is dealing with your body metabolism. Now, what is metabolism? I'll come to that soon.
Yes,
Okay.
yes. So we all know that thyroid is a butterfly-shaped gland often here, and we'll dig deeper. We hear a lot about it, and then most of us don't really know that it what exactly it does. So how about you explain from the beginning of this tiny gland? What exactly does it do for our body?
Yeah. See, the thyroid gland is situated right in front of your neck. Okay. You can even palpate it when you go through. So, this is a hormone producing gland which is dealing with your metabolism. Now, what is metabolism? We hear a lot about metabolism, right? Because everybody is into fitness now. They're like, oh, my
Mhm.
metabolism is this, my metabolism is that. What is your metabolism? So, this is nothing but the process of your food that you take in being converted or broken down into energy. And what is this energy used for? The whole functioning of your body. So if there is something that is controlling this, don't you think that's going to be very important in our life?
True.
Right. So this energy is being utilized by all your tissues in your body, all your organs, your muscles for energy, and everything is governed by this mechanism in your body, and that is controlled by a thyroid gland. You understand?
Interesting. Very simple explanation. Great. So, in your practice here in the UAE, I mean, what kind of thyroid problems do you come across most often?
Okay, so now thyroid, as I told you, is a gland which is situated here in your neck, and it is generally being governed or controlled by your brain. So you have a situation where your brain is going to tell your thyroid gland to produce more thyroid hormones or reduce the secretion of thyroid hormones, depending on a lot of internal as well as external factors. Okay. So now coming to that, your brain has a area called as the hypothalamus,
Hmm.
from which will control another gland which is situated in your brain, which is called as a pituitary gland. Now,
Hmm.
this pituitary gland is the master gland. This gland is going to tell many other smaller glands in your other parts of your body to secrete more or decrease the secretion of a particular hormone. Now, coming to the thyroid, the pituitary gland produces the thyroid stimulating hormone, which is going to tell your thyroid gland to produce more of thyroid, stimulates the thyroid. And that's when your thyroid is going to produce more thyroid, that is T3, T4, we call it, the
Hmm.
thyroid hormones. Okay,
Hmm.
one is an active form, one is an inactive form. I don't want to go into more of a medical knowledge. Now, these hormones are the ones, sometimes it can go down, and that's called as hypothyroidism, which
Hmm.
is more commonly seen. Okay, whereas your thyroid gland is underactive, it's not producing enough thyroid gland or
Hmm.
hormones. Okay, then there is hyperthyroidism, where
Hmm.
your thyroid gland is functioning actively, more actively than normal. That is hyperthyroidism. So that is the two major thyroid abnormalities or disorders that you see very common. Now, again, this is the uh, difference in the functioning or difference in the hormone production.
Hmm.
Now, this can happen due to a lot of condition. Like as I told you, the lifestyle, the environmental or the outside factors is one of the major reason for this. For example, stress, right? And your lifestyle, eating habit, lack of activity, exercise, all this. Plus, there are a lot of autoimmune that is inherent, some genetic conditions. Some people will develop some alterations in their body where their
Hmm.
own body mechanism starts attacking these glands and they will function abnormally. Now,
Hmm.
you can't help anything about that because that's unfortunately a mechanism happening inside your body,
Got
right?
it.
So,
Got it.
but there are things that you can work on, which is the first problems which I told you, right?
Hmm.
The environmental or the external factors or the factors that you are able to deal with.
Right.
Now, iodine is also very important. We all have iodized salt, right? So this is very important because iodine is something which is important, the process of making of these hormones, thyroid hormones.
Okay. Okay. So before we get into the iodine part of it, because that's a very interesting question from the childhood onwards, I've always heard that
Mhm.
have iodized salt, have iodized salt. So we'll get to that point. Before that, I just want to make sure that everyone is going with the same pace that we are. So you mentioned about the most common issues being hypo and hyperthyroidism. This
Yes.
is the most common two form you said. Hypo being that the thyroid gland is not able to produce the required, it's not functioning up to speed, let's say,
Yes.
to put it in layman terms. And hyper is when it's overactive, so it is going beyond what is required. So are there any specific
Mhm.
symptoms in these two categories
Mhm.
which a layman, let's say me, facing these
Mhm.
symptoms, know, oh, maybe my thyroidism is my I'm hypothyroidic, or I'm facing hypothyroid. Can this be easily detectable?
Absolutely. Yeah, because there are entirely distinct presentations for these two
Hmm.
conditions. When
Okay.
your thyroid is underactive, when it's not
Hmm.
functioning properly, if there is
Hmm.
hypothyroidism, your body slows down, your metabolism slows down. And this
Hmm.
is very evident in the form of general tiredness that you feel. So, next time you see somebody tired, just don't think that they might be just lazy. They
Hmm.
might be having hypothyroidism, right?
Hmm.
So fatigue or tiredness is one of the common symptom of having a low thyroid level, so hypothyroidism.
Okay.
Second, weight gain.
Hmm.
Increased weight gain is seen suddenly, can be because of this.
Okay.
Third, you can have mood swings which can sometimes manifest in the form of depression,
Hmm.
low feeling of low, increased sleep, low heart rate. You might feel your pulse is beating very low. There's a decreased energy for you to function. You might
Hmm.
even have constipation.
Hmm.
Because see, I told you this is going to give energy for your whole body to function, right? Now, what if this is not giving energy for your digestive system to digest food? That's going to give you constipation. The body is not able to digest the food properly. Then it's going to give you joint pains.
Hmm.
And especially in women, the hypothyroidism presents with menstrual irregularities. You might have low periods, decreased menstrual activity. It can even lead to infertility. You
Hmm.
understand? So that is hypothyroidism I'm talking about.
Understood. So basically, all these symptoms that you just mentioned may show up in the body, inclining towards hypothyroidism or the presence of that issue. What if we have to talk about the hyperthyroidism?
Yeah. So the hyperthyroid, when there is hyperactivity, definitely
Hmm.
your heart rate is going to increase.
Hmm.
There's increased activity. So
Hmm.
that's one of the things. So when your heart rate increases, what's happening always? Anxiety. You're going to feel
Hmm.
anxious, right?
Yes.
So that's one of the symptoms. So next time you see somebody anxious, sweating, always this could be hyperthyroidism. Okay. And weight loss. So
Hmm.
now your metabolism is so fast, you're going to break down a lot of energy, you're going to break down a lot of fat. So there's weight loss.
Hmm. Hmm.
Loose stools, there's not proper digestion, there's a lot of loose stools can be
Okay.
there. So
Hmm.
these are some major symptoms for hyperthyroidism. Again, menstrual irregularities, all this also is going to happen for that as well.
Which means, interestingly, you just put it across that symptoms may seem absolutely opposite to each other, but when it comes to women, especially women health, the menstrual irregularities are the common denominator in both kinds of both forms of thyroid related issues. So I think that's a very important point to be noted. Great, lovely. Let's move on to the next part of the question that I have for you, which
Yeah.
is that are there any certain patterns, even though you mentioned about this briefly, I just want to dwell on that point, that something that is linked to our lifestyle, like very long working hours, or the way we sit or stand or walk, or the stress in general anyways, or even the diet that can trigger thyroid. Because as far as I have heard, many people who I have come across who have thyroid, they have always said, oh, it's genetic. Is it really genetic, or is it, or it could be both genetic and non-genetic, but it just induced now because of our lifestyle?
Yeah, so that's what I told about. So thyroid can have genetic factors. That is
Hmm.
entirely different category of thyroid issues. We
Hmm.
have a lot of subcategories for it, which can cause both hyper and hypo. Okay.
Hmm.
Now, but there are immense lifestyle impact. That is the most frequent form of thyroid abnormalities that you see right now. It's
Hmm.
not always genetics. The most reason that you see right now is the thyroid abnormalities because of lifestyle, which is stress, definitely. Okay. Now, how is stress affecting? If I want to go deeper into it, the stress is, as you all know, stress increases your cortisol levels, your stress hormones. Have you heard of that?
Of course, yes.
Yeah.
Cortisol, yes. Hmm.
Absolutely. The like I know pretty much every patient who comes to me right now has very good knowledge about all this. They come and ask me, Doctor, is my stress hormones okay? I'm like, wow, you already know all that. So
Awareness.
that is something good. I think they have knowledge, but people tend to miss what are the trigger factors.
Hmm. Hmm. Hmm.
Right. So as the stress increases the stress hormone, the cortisol levels in your body. Now, this cortisol levels, when it increases, that's going to suppress your thyroid hormone production. So
Hmm.
that's how stress is going to affect your thyroid.
Got it. So let's say we spoke about all these symptoms, different kinds of conditions or experiences that we are having in a daily life, which could seem very normal, but if you put it all together, you add one to the other, it may lead to something or indicate something. So let's say someone is feeling constantly tired, fatigued,
Mm, mm,
and gaining weight over a period of, let's say, a few months, or just doesn't feel like themselves really, and then maybe not really their normal selves. How do they know that it's not because of just stress? And when should they actually start seriously considering that they should go for a thyroid check?
So this is what I tell my patients most of the time.
Hmm.
You should know your body. You should know what happens to your body when and how your body responds. Like, for example, you should know your sleep cycle. You should know how much sleep your body needs.
Hmm.
Like for women, I stress on the fact that you need 8 hours of sleep. You need that 8 hours of sleep. And the moment you wake up in the morning after this 8 hours of sleep, you should feel fresh. Now, if you're not feeling fresh, there's something wrong.
Hmm.
Okay, that can be stress, but at the same time you should also make sure that there's no underlying factors to it. And
Hmm.
how can you go about it? Do regular checkups. Regular health checkups is one of the important factor for to get to know your body if it's functioning or not. Now if there's some factors like stress or something that's going on in your body that's continuously affecting you, at
Hmm.
some point of time you should have that sense to go and check if there's anything else that is resulting in this. For
Got it.
example, if somebody is doing everything right in their life, they might be exercising, they might be sleeping, but still, if they are not feeling well internally, or if they present with the other symptoms like menstrual irregularities, or
Hmm.
the mood is not right, right? Or if there's any bowel habit changes that they're noticing, hair fall, it's one of the main thing, hair fall or thinning of hair,
Hmm.
dryness of the skin, all these are symptoms that is linked to thyroid as well.
Okay, okay. So when we say you should get your checkup done regularly, this is something which I've been hearing common. It's a very common thing. Most of the doctors that I've met always have said this: get yourself checked regularly. But what is the definition of regularly? Is
Yeah.
it every month, or is it 3 months? Once in 3 months, or is it once in 6 months?
Mhm.
Or once in a year is okay. Looking at the current lifestyle and the situations and the changing dynamics, what do you suggest?
See, again, now this timeline would depend on the status of the patient. By status, I mean that what is the age of the patient, first thing.
Mm-hmm.
Okay,
Mm-hmm.
and what risk factors the patient has. Risk factors in the sense what genetic predisposition, like anybody in the family suffering from any conditions,
Mm.
right? And
Mhm.
if they themselves have any other conditions, if they are having medical conditions, then their timeline is going to change. For anybody above the age of 40, I would recommend them to have a 6 monthly checkup minimum.
Okay.
Okay.
Lovely. I'm
Now,
happy to hear this because I'm getting it done every 3 months, and I
very
keep
good.
telling
More
everyone.
is better always.
Yes. So and it's so good, like you rightly pointed out, that when we do these checkups, we know where the graph is going, and we know which element or which part of our body checkup is showing high or low, and then we work on that. So great. Happy to know. So once in 6 months is sufficient for
Yes.
most of the people in general
Yes. So the
category.
point is that until and unless you don't have any existing conditions, for
Of course.
normal people where the results are completely fine,
Hmm.
regular preventative checkup or screening every 6 months. But if you have any existing conditions, say thyroid, say
Hmm.
hypertension, diabetes, please do a 3 monthly checkup.
Got it. Got it. Understood. Lovely. Okay, so once someone is diagnosed with a certain lack or
Mhm.
issue pointing towards thyroid-related issues, what does this treatment really look like? I mean, is it always supplementation of the thyroxine, or how is it?
Yes, as you rightly said, we have to supplement the gland which is not functioning properly. For example, now the thyroid is not producing thyroid
Hmm.
gland hormones, right? So now you're supposed to give it, replace it. You're going to replace the hormones externally. Levothyroxine is the hormonal replacement which
Hmm.
you're going to give for hypothyroidism.
Okay.
Right. Now you're going to give it externally. You might have to give it for a little long time because your gland is not functioning and giving it by itself. You're giving it externally. Now, if it is hyper, you're
Hmm.
going to have to cut down the excess production. So you are going to give medicines, like there are some categories like carbimazole, propylthiouracil, so many medicines, which is going to cut down the extra production of thyroid. At the
Hmm.
same time, we are also giving in hyperthyroidism some category of drugs called as beta blockers, which is nothing but medications which are to decrease the heart rate. Because as I said, in
Hmm.
hyperthyroid, there's increased heart rate, increased anxiety. Now you
Hmm.
don't want the patient to go around anxious and with a lot of sweating and anxiousness. So you need to cut down that symptoms as well, the anxiety symptoms as well. So for that, we are also going to give medications to decrease the heart rate and things like that as well in hyper.
Understood. Just for my understanding, and for the benefit of people who are watching this right now, could it be possible that that the symptoms of hypothyroidism,
Mhm.
which you mentioned about fatigue and feeling like you're really drained out, and maybe all of those things connected to that, could there also be a higher heart rate issue, or a slightly anxiety related issue as a combination? Because when you said the symptoms, these symptoms were in different categories of hypo and hyper. Could there
Mhm.
be a case where the symptoms are like connecting to each other, pointing to something which?
You mean mixed up of symptoms, right?
Yes,
Yes.
yes,
So
especially the heart rate part. I'm saying this because I have come across someone who mentioned this, that they have hypothyroidism, they are on levothyroxine for a very long time, but
mhm,
the heart rate is not low, it's
mhm,
on the higher side, so it's more like an irregular heartbeat sort of a thing.
mhm,
So
mhm.
arrhythmia sort
Now,
of a thing. Yeah.
so this happens in cases in people who have existing heart conditions. So it is possible that you can find intermixing of the symptoms, right? So that
Yeah.
is an entirely different scenario, Okay, we have
mm,
a whole different scenario happening in such patients. But now, if somebody is having a generalized anxiety disorder as a separate entity of psychiatric condition, again, this
mm,
could vary in people like that.
yeah.
But in general, in if you say 95% of the cases, when your hormones are low, the thyroid hormones are low, there is decreased heart rate because your body is the heart is not able to pump enough. The
Mm,
contractibility is affected because of lack of energy, right?
mm,
But again, if the patient is been on medication for a very long time, there are high chances that such people, they might not be checking properly, so they'll be taking the same concentration of medicine for a very long time,
mm,
and they might have gone into hyper which they've not realized. I've seen many
mm.
patients come to me like this. They've been on hypo, they think that they are hypothyroidic and they're taking medicine levothyroxine for years, but at a point of time they might have gone to hyper because they've been overloading with the same amount of medicine for a pretty long time. Now,
Mm.
at that point of time, they have gone to hyper and their symptoms shift.
Understood. Very, very, very clear. Yes. So I think this is a very important point to be noted as well, that just because doctors would have prescribed lifelong supplementation of levothyroxine doesn't mean that you don't check it and you just go on a, like a lazy mode and okay, everything is okay. This we need to check still regularly to be in the
Yes.
right.
I
Uh,
get patients with who's been taking 100 micrograms of levotiroxine for how many years? 3, 4 years. So I'm
yeah.
like, you've never bothered to check.
Yeah.
That's not the way. Okay.
True, true, true. Understood. Perfect. Lovely. And there's another scenario that I have to discuss here, which is like, are there certain stages in life, especially like pregnancy or
Mhm.
menopause, or let's say even perimenopause or a post-COVID recovery scenario, where thyroid dysfunction could probably become a bit more likely or a bit more visible, maybe on the surface?
Very, very important question. I'll tell you why. Especially in thyroid, if somebody is having thyroid issues, it's very important to check this before getting conceived or during the pregnancy as well. We have criteria of checking it during the regular checkups of your pregnancy. And why is this important? Because during pregnancy, your thyroid is getting messed up a little bit because there are other hormones which are higher at this point of time. So
Mhm.
this will kind of suppress your thyroid hormones naturally. So if somebody is on thyroid medication, they have to step up their dosage when they are pregnant. Otherwise, that might not be enough for them.
Hmm.
You understand? So that is one important criteria. And again, now what if the thyroid goes out of control because you've not been on the correct medication? That can affect the pregnancy. You have complications like intrauterine death or miscarriages or complications of bleeding and all during pregnancy, as well as fetal problems.
Hmm.
Because maternal thyroid, if it's not in control, can lead to fetal problems. You understand? That's one thing.
Did you say paternal thyroid?
Maternal. Yes,
Maternal.
yeah.
So okay, understood. So
That's
even more
important.
important for people to go for their, of course, regular checkups and ensure, especially if they are planning for a child, to also test the thyroid situation,
Yes,
especially when they are already on the supplementation. So to adjust the dosage according to that,
yes,
and
yes.
not to take a decision on their own and not
Never, never. Yeah,
Google about it and increase or decrease it.
yeah.
Okay.
So now coming to the next question, that is menopause, which is also very important because menopause, I see a lot of women coming in, and let me tell you very honestly, 80% of the time they don't have a physical problem, but they deal with a lot of emotional distress because of the menopause that they're going through, perimenopause or postmenopause or whatever phase they are in. And it's a very hard phase of a woman, I would say,
Yeah.
because of the fluctuations of the hormones that they're going through. And that itself is going to have a lot of toll on their mental and physical health. Now if they're somebody who's having thyroid on top of that, imagine, because thyroid itself is going to come with a lot of emotional vulnerability and the mood swings and things like that. It is going to top up your existing problems of menopause, and which is why it is important to check your thyroid and take adequate medication at that point of time.
Okay, understood, understood. Just out of the scope a little bit, but still, since we are talking about that particular phase of life, which is perimenopause and menopause and postmenopause, is there a certain age? Because many people that I come across, they say only at this age it happens. But I've also understood that it could probably happen slightly before the age also. So it's not
Yes,
a set in stone kind of a age range, right? So would
yes,
you like to
yes.
maybe touch on that?
Correct. Why? Because your age of menopause is not fixed. There are again a lot of factors that depends or affects it, like your genetic predisposition. How when did your mother or grandparents go through that phase, and then your lifestyle. If you are a physically active person, of course your hormones are going to stay a bit longer with you and give you all the push that
Hmm.
you need. But if you have been somebody who's very idle in lifestyle, of course you're going to have problems way early. And if you're somebody who's been active and your hormones have been in a very good range in your body, your symptoms of this menopausal symptoms, like, can I tell the bit of symptoms, because I think it's very important.
Sure, sure, because it is definitely in conjunction with the thyroid related issues, because it could be interchangeable or maybe confusing for people.
Yes,
Hence, it
yes.
is absolutely relevant. Please explain
Yes,
that.
yes. Again, so I think for women, mood swings is a symptom that I should just post it on my head and sit every time and tell that please don't count this as a symptom because this is part of your life. So that is one thing.
Yeah.
Okay. Secondly, it is hot flushes. You'll feel very hot and sweaty, even if the temperature around is normal. That's one of the major symptom that you go through in this phase. Again, joint and muscle pain, because as your estrogen levels in your body declines, you're more prone to losing your bone density, which is why I focus on the fact for exercise, especially strength training during this phase, because to gain more of muscle mass and strengthen your bones, because this is going to naturally decline when your estrogen or hormones go down when you're nearing your menopause. So that is
Hmm.
joint pains, and this feeling of tiredness and muscle cramps are one of the other symptoms. And the other symptom is you're going to feel dryness in your body, especially vaginal dryness and irritations, being more susceptible to infections, fungal infections. All this is all part of it.
Understood. Understood. I'm sure people who are watching this can make note of this and can relate to these symptoms, which may seem like a very simple or normal thing, but it could be a sneaky devil, which is leading you to a serious issue if untreated or if not taken care of. Lovely.
Yes.
So there's another question that I have for you is that I've heard somewhere that itchy skin could also be a symptom of thyroid.
Mhm.
I mean, does it really affect the skin?
See, yes, it does, because as I told you, the hypothyroidism can give you dry skin because
Hmm.
there's not enough moisture. There's your metabolism and your whole body is slowing down. It's becoming sluggish. So
Hmm.
what is happening? There's no enough moisture, and it can cause to dryness. Now, what happens when there's dryness? It can lead to itching, and you can get eczema, urticaria, and so many allergic reactions you're prone to. Which is why that can be a symptom in hypothyroidism mostly.
In hypothyroid, but not in hyperthyroid situations?
Not very likely. Yeah.
Okay, okay, got it. All right. So when we talk about habits,
Mhm.
what kind of habits do you think are generally considered bad for either of the thyroid situations?
I think all the habits that most of us have in this generation is considered bad. I would say.
Please explain.
Yeah. So to begin with, I think the most important is physical inactivity or sedentary lifestyle.
Mm,
Okay, why I'm focusing this is because when you are being physically active, you are stimulating your body to improve its metabolism.
mm,
Thereby, your metabolic function, which is done by thyroid, is improving. Right.
mm,
So now, if you are not making it happen in its own way, and if you're not aiding to that, definitely your body is going to slow down. Your metabolism is going to slow down.
for
Right.
sure.
So physical inactivity or sedentary lifestyle is one of the important things. Second, sleep. Sleep, not having enough sleep again wrecks up your hormones, because there are hormones which is produced at night in your body. Like, so now if that hormones are not being produced, ultimately I told you all the hormones are governed by a center in your brain. So if that's not functioning by adequate sleep, your brain is not getting enough sleep, that's going to affect it. That's
Understood.
another
Understood.
worst habit. Again, another one is not having a healthy balanced eating lifestyle. A
Hmm.
balanced meal where you get all the nutrients. I'm not talking about keto. I'm not talking about all those fancy
Yeah,
whatever is there. I'm talking about balanced lifestyle.
balanced food. Yeah, yeah.
Okay, yeah, that is there. And again, stress.
Hmm.
I've already gone through what stress causes in your body. That is very important. And this nighttime activity of staying awake, munching, all that is totally wrecking up your full metabolism body. Of course, smoking, alcohol, all this is definitely having an effect.
Hmm. Okay, understood. So, let's say when we talk about mothers who are expecting a child, childbirth, pregnant women,
Mhm.
what should they know specifically about thyroid screening? Whether they are on a medication or they're not, they're oblivious of the fact that they could have a thyroid issue. Should it be done in all cases?
Yeah, so this is part of our regular screening. So we have a set of blood tests that is to be done when somebody is diagnosed as pregnant, somebody is confirmed pregnant, then
Hmm.
we're going to have a particular test, and thyroid is part of this test. Okay,
Okay.
so that is anyways going to be done. And if they are found to have variations even at that point of time, or if they are somebody who's having thyroid, you the doctors will adjust the dosage accordingly. All you have to
Understood.
do is take it properly, and during every maternal follow-ups you're supposed to go through this screening. And
Okay.
we even have ultrasound scans during pregnancy to check for the fetus, in which we'll be able to see if there's any fetal anomaly that is
Hmm.
likely to develop because of all these effects.
Understood. Okay.
Understood. Yeah.
Super, super. Okay, so and then so that also covers, I mean, how to manage thyroid with pregnancy, because obviously when the tests are being done and it's a part of a general, it's a set,
Yeah.
a screening list of things. So I
Mhm.
think that is taken care of. One very simple, I mean, normal question that people have is, if I'm on thyroid medication, I need to take it lifelong,
Mhm.
which, I mean, as a layman, I feel maybe it's a fact. Oh, yeah, thyroid for lifelong, lifelong.
And it's a
But is
very
it needed?
valid concern as well.
Yeah. So what do we do then? Is it actually true that it needs to be taken lifetime?
See, I'll tell you what. Again, it depends on what is your current status. For somebody who's having a very low thyroid functioning or under function thyroid, we are trying to push the thyroid to function properly by giving these hormones, right?
Hmm.
So if at a point of time your hormones picks up the function and is able to produce by its own, then we can gradually decrease the dosage and bring
Yes.
it down and try to bring it to a minimum and see if the patient is able to produce it by himself. Okay, I'm
Wow.
talking
Which
about high.
means you're talking about if the gland is able to revive over a period of time to be able to produce. Wow.
Yes. Okay. So what happens for somebody who's having thyroid hypothyroidism? We start them on 25 to 50 micrograms of levothyroxine or whatever, and we're going to give them for a pretty long time. After a point of time, the thyroid comes normal, starts
Hmm.
coming normal. We slowly decrease the dosage.
Hmm.
Somebody who's on 50 will bring it to 25. This is not done over a month. It is done over 3 to 6 months.
Hmm.
Okay,
Okay.
and we
Hmm.
always follow up them every 3 months. That's what we do. And for your knowledge, we never start thyroid medicine immediately. We assess the patient, we assess the symptoms, we see if there is proper decline in the T3 T4 levels, thyroid hormone levels. Okay, then only we go through the medication option. So that is also there. First we try them to push them to go for the lifestyle changes and see if
Yes.
that's
Yes.
working,
Hmm.
and then only we start. And if they're able to pick up the good function after on medication, then we can bring down the dosage, and we can see and even try to stop it for a while and see if they're able to produce it or not.
Produce
That
it.
is about hypothyroidism. Coming to hyper, of course, hyper happens because of mostly some external factors, say maybe some chronic illness or some surgical or some other autoimmune conditions, whatever it is. See, autoimmune, I'm sorry, sometimes you might have to go for a lifelong treatment because it's autoimmune. Your body itself is going to produce a
Hmm.
substance that is kind of destroying your
Destroying your
gland.
own. Yeah.
And then in those cases only we have to go for a lifelong treatment.
Hmm.
But in others, again, if your thyroid hormones have been stopped producing extra of that, then we can stop the medication that is given to stop the excess secretion, of course.
Understood. So what I understand from this is that no matter what it is, there's always a ray of hope. The silver lining is there that I may not have to take it lifelong, provided I am consistently checking it every 3 months, following it to the T, the medication and the schedule and the quantity or the intensity of the medication itself,
Absolutely.
and not taking it for granted for sure. Now, when we talk about this, what specifically are those tests? Because I hear FSH, I hear T3, I hear T4,
Mhm.
I also
Yes,
hear
yes.
TPO. So now
Yeah.
what do we do? How do we package this? And is there in layman terms, if I need to go for my checkups regularly, what should I follow?
Yeah, I really like telling this because I explain to my patients about their thyroid, how this function, because it's very interesting.
Yes.
You can also listen to it now. So, your thyroid hormones, what it's produced is called as T3, T4. Okay, just remember. So, we are going to test for T3, T4 thyroid hormones. Now, the thyroid, which is hormone which is produced by your brain, which is going to stimulate your thyroid gland to produce thyroid hormones, is called as TSH,
Hmm.
thyroid stimulating hormone. So
Okay.
you have a thyroid stimulating hormone produced by your brain, which is going to stimulate your thyroid gland to produce this T3T4. So we
Hmm.
are going to test all these three hormones.
Hmm.
Okay. Now, and why is this important? Because when your TSH is more, it is increased and it is stimulating your thyroid gland, your thyroid is functioning properly. Now, when your thyroid goes low, your body, your brain is going to produce more of TSH and it's going to tell your glands, please secrete more. So, somebody who's having a low thyroid levels with low T3, T4 levels will have an elevated or increased TSH levels. So,
Got
it's
it. Hmm.
first. It's very
Wow, that's
important.
interesting.
Why? Because I get patients coming and telling me, doctor, my thyroid is high. Because they think they see TSH is high, they think that their
Yeah.
thyroid is high. No, that means your thyroid is low.
True, true. This
Yeah.
this has happened with me as well in my life too.
Mhm.
Of course, in my personal life with
Uh-huh.
my own partner, and we've had these discussions, and often it is, and it's not a common knowledge actually. People don't know about this.
No, no, not at
So,
all. Yeah.
but it's such a simple thing you just said. Just to recap, so
Yeah.
TSH is basically the hormone which is produced by the brain itself to tell the thyroid gland to create T3, T4.
Yes. Yes.
And if
Yes.
T3, T4 is low, obviously TSH is going to show us a bit high because it's trying to signal, hey,
Yes.
create this or produce this.
Yeah. So,
So,
and to add on to this, if your T3, TSH is so first itself, your when your thyroid goes to become underactive, your brain will get the signal. So, firstly, the sign that you see will be mostly a raised TSH.
hmm,
At that point of time, not necessarily your T3, T4 might have gone down. So,
hmm,
this we call as subclinical hypothyroidism. But clinically, you're not hypothyroid yet, but your
yeah.
brain is signaling that this is about to get underactive, please secrete more.
Oh,
Okay.
wow.
So we don't start medication at that point of time. We only start medication. That's the criteria when I told you we don't start medication.
Yeah. So we do lifestyle changes and try to, ah,
Only when this goes down and this goes high together, that this happens, that's when we start the medicine.
that's when we have gone off track
Yes.
and we need to depend on supplementation. Wow. What a beautiful creation of God that, the
Yeah, I
brain
know, right? Yeah, yeah.
functions in such a magnificent way that it actually gives us a signal. So precaution is better than cure. Your statement in the opening is kind of proven there. So, which is great, lovely. I've got another question for you, which is what nutrients in
Mhm.
our food or intake
Mhm.
are absolutely necessary other than iodine, especially in people who have the thyroid dysfunction.
See, there is not particular thing that you need to, take to improve your thyroid. Because people come asking me, doctor, which vitamins should I take to
Yeah.
improve your thyroid? No, because this is not something which is going to be activated by a particular vitamin. This is
Hmm.
something which is governing everything. So don't you think you need to give everything which is important to your body to make this function? You
Wow.
understand? So at the same time, there are certain food which we call as goitrogens, or things which can be, which is considered as not very likely to be benefiting a thyroid, or I don't want to say the word harmful, because you don't consume those as so much as well. But foods like cabbage
Hmm.
and all is considered to be goitrogenic, in the sense that they might sometimes lead to decrease of the thyroid levels, which is why if you've heard people telling that if you have thyroid, don't take cabbage and all.
Yes.
To be very honestly, the amount of cabbage that we'll take in a meal is going to be maybe say one
Yeah.
bowl or whatever it is. So that's definitely not going to affect your thyroid until and unless you eat like a huge amount of cabbage on a daily basis. Yes, then that makes sense.
Yes. Okay. Okay. Interesting. So, the answer to that, I think, is that we need to be careful about our food, in terms of having a balanced diet, which is nutrient dense and not just probably multi. What do we say? Not just the macronutrients, which is the carbs and fiber and protein, but also the micronutrients elements of that needs
Yes.
to be very, very. And then I think
Adequate water, 2 to 3 liters of water, and low fatty foods, especially because now that's going to slow down your body functioning, because by it will increase your adiposity, increase the fat deposition. Now that's going to be
And
bad for your thyroid ultimately.
of
So
course,
that is also very important.
it's all interconnected to each other. You see, it's all,
Yeah.
and like they say, what goes in through what we eat is basically what.
Medicine is very, very interesting. Yeah.
Yeah, it's amazing. All right, so there's another very interesting question that I have, which is now we spoke about what is going to be good. You also touched upon the goitrogenic food, which may interfere with the thyroid treatment. Anything else apart from that, which may any kind of medication which may interfere, maybe?
Yes. That is very, very important point. Why? Because now everybody takes supplements, which is very good, because we don't get enough nutrients from our daily diet because of the
Yeah,
fast lifestyle.
yeah,
So I also tell my patients to go on taking their supplements. At least that will help them give the necessary nutrients. So
yeah.
now, if you're somebody taking calcium, iron, and all, make sure that you don't take it at the same time of you taking the thyroid. That's
Hmm.
very important. So if you're somebody who's taking calcium and iron, make sure you take it 4 hours apart of taking your thyroid. So always we take a thyroid medicine. That is, I'm talking about levothyroxine. We take it empty stomach in the morning. That's how your thyroid medication is usually taken. Okay.
Yes.
So if you are taking a supplements, take it 4 hours after it. So if you are taking this in the morning, take it in the afternoon. That's better,
Okay.
because that's linked to work against it, or
Understood. Basically,
function
it
will go.
yeah, so it impacts the absorption rate of the second
Yes,
medicine that you're taking in.
yes.
Understood. Okay, perfect. So lovely. Is there anything that you think people can do to build a thyroid friendly lifestyle while still being under a stressful job schedule, always on pressure, target this, that, da, 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 da. Other than being active, not too sedentary, which anyways you are in the office, so moving and working out and eating good food, nutrient dense food. Other than these two or three elements, is there anything else that you think could be?
One thing I'll tell you, like I just want to touch a part of the activity here. See, when I say about activity, in a week, if you can spare 3 to 4 days, half an hour of activity is enough. I'm not telling you to, be very physically aggressively active by doing strength no, 3 to 4 days, half an hour of activity in any form, be it swimming, jogging, dancing, whatever you like, something. Just do it, that to keep your body active. now
Hmm.
now that is activity, this I want you to do basically as a part of activity in your routine. Now, other than that, when I talk about sedentary lifestyle, everybody is doing a 8 hour duty, 9 hour duty, whatever it is, a sitting job, right? So what I want everyone to do is, if you are sitting for like a 1 hour long time, take a 3 minutes break. Go for a walk, go drink tea or water, go to a washroom. Every 1 hour, a 3 minute break is very important. Okay,
Understood.
so that is the way I would like to push the break this routine of sedentary lifestyle.
Hmm. Hmm.
Okay, and secondly, in regards of thyroid, the tips that I want to tell is, again, regular checking every 3 months, and do not skip the medication until and advised by your doctor.
Doctor, got it.
Understood. Yeah. And again, the monotony in life or the stress is one of the major factor. So please take breaks every 2 months. By break, I mean take a 2 day off. Very, very important from your routine. Unwind, set up your mind, do a slow living, slow mornings, and a nighttime routine where you concentrate on your breathe and your whole body functioning, and going to sleep is very, very important.
Understood. Understood.
You got it.
Lovely. Lovely. So now when people are doing this, let's say we are following the right things as you said, as you advised, and but still someone is on a thyroid medication long term,
Mhm.
is there any side effect of this thyroid supplementation in a long term basis?
See, long-term basis, you are not giving a particular medicine to your body. You're not altering any mechanism of your body. You're just replacing something which is not there or being produced by your body, right?
Hmm.
So in that regards, you are not going to have any long term serious side effects. Of course, if somebody is on a particular medication for a long time, you have minor side effects like some gastric irritations or some kind of general uneasiness and nauseousness you can develop for a long time. Other than that, there's no hazards for such medications which are considered to be hypo replacement for thyroid gland. But if you're taking a anti-thyroid medicine like say your carbimazole or things like that,
Hmm.
it is very important to especially in pregnancy and all, the anti-thyroid medications has to be changed to non-teratogenic, or the ones which are not harmful for the baby. Not all anti-thyroid
Hmm.
medications are okay for the baby, so we need to change those
Hmm.
medications accordingly. And even during lactation, it is advised to change into particular medication which is advisable only during that time, which is a very important thing.
That we're talking about in the case of a pregnancy scenario, especially in hyperthyroidism.
Hyperthyroidism,
Yes,
yes, yes,
hyperthyroidism case.
yes,
In hypothyroidism, obviously, it is going to be a lifelong supplementation, and there isn't any severe side effects as
yes,
you
yes,
mentioned. At the same time, I have a layman question before we move to the next segment, which is like many people say, like sometimes I've heard parents say this: "Arey,
mm-hmm.
you keep on taking these things, you'll get dependent on it, or eventually you would need more of it because you get addicted to it." So
Mm-hmm.
that scenario doesn't really apply. That psychology doesn't apply to thyroid medication.
See, I told you, right? In case of thyroid, I feel that the more you take a particular dose, the more you make your body get used to it, and your body will start becoming okay to it, and you'll need much lesser dosage in the longer run.
So it works
Until
exactly in the opposite manner then.
yes, yes, because now your gland is okay. Now something is there, it's coming. Now I need to produce the same thing. Okay, let me also produce it. It's going to produce the same thing. So now you need lesser amount when your glands start making it in a normal level. Again, I'm not talking about the autoimmune condition. I'm talking about things which are caused by lifestyle, especially, or iodine deficiency, or
Understood,
things like that.
understood. So which
And
means there is that hope that
yes,
as long as our body it doesn't have the autoimmune issue or disorder, and as long as the physical capability of thyroid gland itself to
mhm.
produce
Yes,
is not hampered, there is always a chance that we can in a long term expect that okay, it can come back to a proper functioning level,
yes, yes.
provided we do everything right. That doesn't mean, of course, that we doctor says 75 mcg and then we're just going in and topping it up by another 50.
Yeah, 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 absolutely. Because see, until and unless, for example, somebody who's having thyroid is going through a lot of stress in between. Obviously, now you're racking it up. You might need a higher dosage.
Yeah, but
Yeah.
again, doctor has to advise that after in that 3 monthly
Yes.
test that we do,
Yes.
which
Absolutely.
they will correlate with the cortisol levels and other things and other.
Yes.
Perfect. Lovely. This is great. I've been enjoying this discussion so far, and we're almost like 45 minutes in
Yes.
into the
I
session.
didn't even realize that. It is really
Neither
fun.
did I. I hope the people who are watching this are also enjoying this and making notes. I've got this
Cool.
very quick session. It's a very interesting segment. It's called myth versus fact. So I'm
Okay.
going to ask you some questions. All you have to do is just say myth or
Mhm.
fact, and feel free to maybe explain why you choose a certain side. Maybe a one-liner explanation would be great. So let's see the first one. Okay, here we have.
Uh-huh.
So only women get thyroid problems. Myth or
Myth.
fact?
Myth. Yeah.
Myth all the way. Okay.
Yeah, yeah. Because men
Explain why.
also has the thyroid gland, and they are very prone to thyroid disorder. Just that it is little bit more common in females. That's all.
Why is it more common in females?
Yes, because it's more evident in females because of the menstrual irregularities and the existing hormones that can sometimes generally affect their thyroid. Especially
Understood.
physiological changes is more common in females, like pregnancy, menstruation, stress is little more in female. Everything is very dependent in the thyroid. That's all.
Hmm. Interesting. So a lot of times I've come across this statement that men don't understand. Men don't understand what we women go through, and
Yes.
I completely understand the fact because there are so many complicated scenarios in terms of the hormonal changes and physical bodily changes internally and externally, and men don't have to not probably worry about it. And in men also, the thyroid could be there, but the
Mhm.
symptoms are not as visible because of these differences in the
Yes,
nature of the
yes,
body.
yes, yeah.
Lovely,
And
thank
in
you.
general,
So
I feel men cares the least. So I don't think if you feel low, Joe, will you go and think, oh, my thyroid might be on a problem? You'll be like, no,
yeah,
it's just a bad day.
True. I mean, I think the lack of awareness could be a
Yes,
reason because
yes.
I was oblivious of these things, say 5 years back. You see,
Mm,
so after getting married and after living with a person who understands these scenarios, and of course I had seen it firsthand. So when I experienced that, and then I see, oh wow, so many people around me are actually facing this problem, then
yeah,
that becomes a concern, and then you open your brain to reading and
correct.
understanding and researching and then awareness. So I hope
Yes,
people, whoever is watching this, if there are men this in this forum, please understand more and be more empathetic, I would say,
correct.
towards the situation. All right, if your thyroid test is normal once, you never have to worry about it ever again in life. Myth or fact?
Myth.
Why?
Yes, because as I told you, it's definitely going to have variations. If you are somebody who's had it once, you need to be on follow up and check it always to make sure that it is in your normal limit, because it's definitely going to get affected by all the external factors. Your life is not the same always. You go through a
Yeah,
lot of exacerbating factors during the while, right? So
true, true,
you
true.
do will have changes.
Understood. Understood. So, high blood pressure is always related to thyroid.
Not always.
So it's not a myth.
It's not a myth, but I would say it can have effects, but it's not directly linked.
Understood. It can have effects. Okay.
It can be
So,
a symptom in, especially in hyperthyroidism and all. When your heart rate is high, there's chances of increased blood pressure. That can be a symptom. Yeah,
okay. Okay. It could be a symptom rather. Okay.
yeah.
Lovely. So, another one here is that you can manage thyroid conditions through diet alone. Myth or fact?
Partially again, partial myth, I would say.
Okay.
If you are somebody in early phases, yes, makes sense. But if you have crossed that stage, it's not just going
So,
to
from subclinical, you've already become a clinical
Wow,
declared.
look at you. You've already mastered it.
But
The
you're
medical
giving the
terms.
yeah, but you are actually explaining in such amazing, such simple way that I am able to understand from a layman term. I'm understanding it. I'm sure people are also, able to
So glad.
grasp it.
I'm so
Yeah,
glad. Yeah.
yeah. Another one is thyroid problems are mostly genetic. You can't do much to prevent them. Is it myth of
Myth, yes, because by
yeah,
now you would have already understood that. Yeah.
yeah? You've explained that in the beginning itself that it could
Yeah.
also be
Mm.
stemming up as a new issue altogether, even if there is no past history. Okay, so all thyroid patients gain weight is a myth or a fact?
Myth, because I think you should answer it. Which
Only
thyroid?
hypo.
Yes.
Only Yeah, only hypo
Yeah.
would probably gain weight, and hyper would probably be the opposite of
Yes,
losing weight and losing the
absolutely.
muscle mass as well.
Yes,
All
yes,
right, all
yes.
right. Lovely, great. So let's see if we still have a few more, about 8 minutes or
Mhm.
so.
Mhm.
Let's take up some questions that we've gotten from the audience. Yeah.
Wow, love it.
So
Let's do it.
one is, I've been gaining weight even though I eat healthy and I exercise regularly.
Mhm.
Could it be thyroid? So I'm
Please
assuming this
check.
person has not been diagnosed yet.
Mhm, mhm. There are chances, so please check your thyroid levels. If somebody is going through such issues of weight disturbances, mood fluctuations, fatigue, and everything, the first thing is before starting a diet or exercise, check your hormones and vitamins to make sure that this is not the trigger factors.
Okay, understood. So another question is that, is insulin resistance connected to thyroid dysfunction all the time?
Most of the time, yes, because as I said, the thyroid is linked to your glucose metabolism in your body. So
Hmm.
when there is insulin resistance, especially in cases like PCOD in females, and when there is high cortisol levels, there's insulin resistance. So all this is definitely linked to thyroid as well.
Hmm. When we talk about insulin resistance, I think it's also important to just maybe in one line, if you can explain, how do you know that you've got insulin resistance?
See, insulin resistance, again, it's just a feature. Now, what
Hmm.
is it exactly? Your body is not having the enough ability to utilize the glucose levels in your body, on your blood, right? So the insulin is not actively functioning, and your cells are not taking up the glucose levels, and it is spiking up in
Yeah.
your blood. So there
Hmm.
is increased blood sugar levels, and this is very commonly seen in female conditions like PCOD, which is very common lifestyle disorder these days. Okay, that's a whole different topic that we need to discuss about. Maybe later on, sometime we can do that.
Absolutely.
Second is high stress hormone cortisol levels can be one of the reason. Okay, and thirdly, genetic conditions can be a reason. So there are a lot of conditions that can lead to insulin resistance as well.
Great, great. I'm thinking that people are so interested in knowing more and more about this. I think
Mhm.
this is definitely an eye-opening session for a lot of people out there, and I can't see the gender of people who are logging in. I'm sure most of them are women. Hopefully, there are some men as well, because this is an equally important matter.
Mhm.
Whether you're a man or a woman.
Mhm.
So we will move on to the part where I just want to understand from you, as a closing message, if you can just maybe sum it up. Since we have so many of our viewers who are working professionals, most of them, yeah, and some of them are very high pressure jobs and very very demanding lifestyles. How to manage energy, focus, mood, while at work and also while at home,
Mhm.
um, while dealing with thyroid conditions or thyroid like conditions which is not still clinically proven.
Okay, so now coming to that, in Dubai, the life is very, very fast. I have been in Dubai since past more than 2 years, and in such a fast-paced city where work is very important, the routine is very tight. Morning, everybody starts their day by 6, 7, and it ends late by 10. Please spend 1 hour a day for yourself
Mm,
and focus on slow mornings and a good bedtime routine, because your body will give you signs the moment it starts increasing. It's more than what it can do. The
yeah.
mental exhaustion, I'm not talking about the physical exhaustion, the mental exhaustion is one of the reason why your body is giving you signs. So try to pick on that. When you see yourself tired, take a break, pause, relax, reset, and then get back to your routine. This is very, very important in a fast paced city like Dubai. Why? Because nobody has the time to look up about themselves. Nobody has the time to do regular blood checkups. Please find time for all. This is one important thing that I want to tell everybody who's watching this right now.
Amazing, amazing. That's a very important and yet easily ignored
Yes.
thing that you
Yes.
just mentioned. We've got another 4 minutes to go, and I want to just also maybe just share with you that, in my own personal experience, what has happened is that, since we were going through as a couple, we were going through these new experiences of, oh, there is thyroid, oh, maybe this is maybe this is that. Um, Many people, or most of the people that we've spoken to, they all say, oh, lifestyle changes, go work hard, oh my god, strength training, you have to push yourself in the. But what I've and even I was of the same opinion, and then I was like, okay, towards later, few
Mhm.
years down the line, I understood that just because they say work out or be more active doesn't mean that you go and you just like go and picking like heavy 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 weights which you can't even lift.
Yes.
Because anyways your body in especially in hypothyroidism, your body is going through that kind of a low fatigue moment,
Yes.
is drained out of energy. You're not feeling up to it. Maybe there is some inflammation in the body and maybe you're feeling the pain. Still, if you push yourself more, you may even increase the issues.
Stress
And then
hormone levels are going to increase. Your cortisol is
exactly.
going to increase. That's why I told you. That's why I focus on the point that half an hour of activity of your like.
Yeah,
That's only what I'm asking for.
yeah.
Not strenuous activity where you push your limits. And okay, if you are going to go for some competition where you want your body to look that way, that's this different
That's a
story.
different story. Yeah.
Talking about normal individuals who are busy at work, 8 to 9 hours driving in traffic, in being on road, being at work, sitting in front of screen. All I'm telling is this half an hour in a day where you're giving is actually you giving time for yourself.
True.
Consider activity as a time where you're giving time for yourself to relax, hear some music, go for a jog.
So basically, it's important to have adapt a lifestyle which is of good, clean diet. At the same time, work, as in even if you're working out in the gym or whatever you're doing, even at home, not to stress or not to increase the stress levels if you're not feeling up to it. Going
Yeah.
through that motion of just being active a little bit, even just
Yeah,
walking and do the thing probably.
especially in case of thyroid, where weight gain is a symptom. People
Yes.
sometimes stress out. Oh my god, my
Yeah.
weight is
Yeah.
increasing. I can't lose it. Please take away that notion.
Exactly.
That
Exactly. Because
itself
that
is
itself will hold
sign.
on to the weight,
Yes,
and not
yes,
let you lose the weight. Yeah.
yes. You
Lovely.
see people with puffy face and everything.
Yes.
This all
Yeah.
ultimately the stress hormone that's increasing the
True.
inflammation in your body, and all this is
Yeah.
happening. So
True.
yeah.
Wow, what an eye-opening session. The conversation was so amazing. I didn't even realize the time just flew by. It's been 59 minutes in this
Very
conversation.
true.
So
Very true. Yeah.
thank you so much, Dr. Ajila, for shedding light on thyroid and things around it. So for everyone who's watching, if you're feeling a little off and you don't know, you can't explain or pinpoint why, just listen to your body, because your body is very, very smart. Your brain can tell you. So don't wait for symptoms to just erupt and get worse. Thyroid disorders are very common, and but they're also manageable with the
Yes.
right kind of care and the awareness, and the awareness that you have within your circle. So at Policy Bazaar UAE, we were committed to your total well-being, from health insurance plans that cover diagnostics and specialist care that basically take care of you, all the way to empowering each and every one of you with a reliable health information. And then we are here to help you make those informed decisions about your health. So thank you everyone who's watching this session, and we'll be back with more such sessions to keep your health at heart of everything. And until then, listen to your body, trust your instincts, and remember, even the smallest gland can have a powerful voice.
Wow.
Thank you. Take care.
Thank you all. See you.